You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with mini dental implants, small diameter implants. According to my first guest, he says nobody should be wearing a loose fitting denture, that they should be stabilized on mini implants. With us, we have Dr. Chin. Dr. Chin, welcome to the program.
Thank you for having me on the show.
Now, we have some of your photos, so we'll get to those in a moment. Now, for people that don't know your practice,
Yes.
Who's a typical patient? What are the different services that you offer?
Well, my typical patient is someone that comes to our office with loose teeth, perhaps missing teeth, and they're headed toward dentures, and they just hate the thought. They want fixed teeth. So that's one category of patient. My other patient that I see is someone that they have their denture already, and they're really frustrated with it. So they present to our office actually in three different categories. One person has just a brand new missing denture, and they put it in their mouth for me, and their face is like this. It pops out and it just doesn't fit. And they're really frustrated with them. They're having a tough time going through the adjustment period. They said it hurts. They can't put it in. So they keep it out of the mouth. They came to me with their dentures in the purse or in a bag.
Oh, really?
Yeah, so that's literally how I see them. That's the first category of patient. And they just hate their denture. That's why they see me. And then we have a second category patient who's been to the dentist probably 15 years, and they have their denture, but they hate it because they have to use adhesive to glue it in, all the hassles with it in and out, but it doesn't work anymore because now they've lost all their bone. Okay. So they're really frustrated. That's the second category of patient that sees me. And that second category of patient, we give them a full arch of fixed teeth so they can smile, eat, and chew comfortably.
Okay, good.
Then we have a third category who's that same patient before, 10 years later, who has no teeth. They don't even wear their denture because they don't have any bone. They've been to 6 different dentists. They're edentulous. They're no teeth, and they're really frustrated.
Isn't it true though that if you've been wearing a denture like 15 years, that you can't do this? You don't have enough bone to get these mini implants.
No, I don't think that's true, Randy. We see and we hear that all the time. With the minis, they're smaller, so we don't need as much bone.
So these are different than regular implants. There's 2 types of implants.
Yes. Yeah, the big traditional ones, they need a lot more bone. You have to have bone grafting, sinus lifting, all kinds of other procedures. But the minis are much smaller. And in fact, the vast majority of times, we don't even use a scalpel. So it's going to be more comfortable, especially for the high fear patient. It's going to be less invasive. The treatment time is less. The post-op discomfort is less. The healing time is faster, and the cost is less.
So they could come in with no teeth and walk out on the day of the procedure and walk out with teeth?
Yes.
That don't even come in and out in some cases?
Correct, yes.
Now, are these mini implants strong enough? I have dentists, they've been on the show. So Randy, they're not there yet.
Yeah. Now, there's been studies, the 10-year study with Dr. Shakin, where they've done thousands of them, and the success rate's about the same. There's not much difference in it.
Is that right?
Yeah, and I've done dentistry for over 30 years, and I don't see much difference in them.
So you like it?
Yeah, in fact, I like it better because it's less invasive. It's simpler. Our patients love it more. In the past, people would come in for big cases with traditional implants, but their complaint was it was too costly. With the small diameters, about half the cost. Much more affordable, so our patients love it. That's an added plus for them. We have this one patient, she's had a removable denture for years, and she just hated it, and she wanted fixed teeth. And she actually had traditional implants, surgery, sinus lift on the left side. And so she knew the cost. And we presented her mini dental implant procedure without bone grafting, and we did the right side. She knew it was half the price. In fact, she told me that her husband didn't know it, but she's gonna rob the bank, steal it, somehow get the money, she's going to have it done. And we did the right side, and she was happy because it looked beautiful.
Now, even with the mini implants, let's say you take a denture wearer or somebody actually that was headed to dentures, maybe you have to extract teeth and give them these, like a fixed teeth. What could they eat, and how soon can they eat?
Oh, I have a patient that she came into the office about 10:30. She left the office about 2:30 with fixed teeth. She came to us with no teeth. We saw her the very next day to check her, and she said she was ready to go because she said she ate dinner that night. She ate breakfast that morning. And
you could eat that soon?
Yes, that soon. As soon as the anesthetic wears out, because it's just a simple local anesthetic, it's less invasive, it's more comfortable. It's way better, my bias, than traditional implants.
Is that right? So you like them. Now you do both IV sedation, you're licensed for that, and oral sedation. How many people take advantage of that?
Oh, probably about 50% of all the patients. The patients that we see are very high fear. They tell stories that it took them 10 visits just to be able to pick up the phone to call us, or 10 visits before they can touch the door. We have patients that come into us with 10 dentures in a bag, and they're crying.
10 dentures in a bag?
10 dentures, and they tell us the story that they hear, and they're so afraid, so fearful to have treatment. And I understand, because I was one of those high fear patients. I had that treatment myself, and I have memories of how it was as a youngster to have painful dentistry. So I welcome these patients because I know their fear is real, because I have it.
Your son's a dentist, right?
Yes, my son is a dentist.
And so when did you know you wanted to be a dentist?
Oh, I think my sister was a dental assistant, and I followed her to work. So I was a teenager, and I thought, I kind of like this. The dentists were pretty cool. He talked to me, spent time, and that's how it started. Now I'm a dentist, and my son's a dentist.
Okay, good.
We got one more coming.
All right, another dentist in the family?
Yes.
You said there's two groups of people that are doing this. People that are headed to dentures, really bad teeth.
Yes.
And then the denture wearers.
Yes.
Are there a lot of denture wearers where you are in Las Vegas?
Yeah, there are. We have this proposed NFL stadium. I'll bet we're probably going to fill it 10 times with people that have loose teeth or missing teeth and are heading toward dentures. And as Las Vegas, we probably have tens of thousands of people with an upper denture or a lower denture.
So if there's that many people in Las Vegas that could benefit from these mini implants, why aren't they all doing it?
Yeah.
What's your take?
Well, Randy, I think the number one reason is that they don't know their options. They don't go to the dentist. The average person probably with a denture probably hasn't seen a dentist in 5, maybe 6 years. And if they do, usually it's because they had a broken tooth, or they got a loose denture, they have to have it realigned, or they got a sore spot, or their denture snapped in half, so it's an emergency. So this person doesn't normally usually see the dentist regularly.
So they don't even know these exist?
Yeah, they don't know the options. They don't know that we can offer something that makes it nicer to chew, more comfortable, just like their natural teeth. And the second reason, Randy, is I'm a dentist. They don't want to see me anymore. They don't like that. Let me tell you the perspective of a denture patient before they became a denture patient. Usually they've gone to the dentist, they've been a good patient 10 years, 15 years, 20 years perhaps, and they've gone back and forth from the dentist to the specialist. Numerous visits. They usually had a root canal, then it failed, and they had pain and discomfort. They had bacterial infection. They have mouth odor. Teeth start to get loose. Teeth start to flare. So when they talk, they talk like this. Patients actually show me that. They talk like that. Then they end up losing their tooth. Then they have more mouth odor. They're losing another tooth.
So a lot of money.
Yeah, a lot of money, a lot of visits. They get frustrated. So when they have their teeth removed, they actually are very happy. They're relieved. And
because it's all over.
Yeah, it's all over. And a good example would be my father. He had a denture. When I asked him how happy he was with his denture, he said, "They're fine. I like them. I keep them right there in the drawer." And I realized that, he didn't like them. He didn't like the inconvenience. It's a pain. It just didn't feel natural for him.
Did it take you a while to talk him into it?
Oh, it did. It did. But he was happy. Like a lot of patients, that the visits were over.
Yeah, but what about the people that have gum disease or like bleeding gums or bad gums?
Yes.
Will the mini implants stay in those people?
Yes. That's the ideal patient, Randy. That's who we want to see. When we take out the teeth, it gets rid of all that bacteria out of their system. It's healthier for their heart. It's healthier for their brain. And so we like to get them healthier, and then we can place the implants, something that's been used for decades in the medical world, titanium implants. So they have a new them after we put them back together. They have a new smile. They can eat and chew more comfortably. It's like having a third set of teeth. It's just more natural. They can taste their foods better. They don't have to worry about all this.
I mean, they really can't eat. I mean, because I've seen mini implants.
Yes.
They seem small, so
yes.
They can eat a steak or broccoli or
they can eat
salads.
They can eat a wide range of things. The common things I hear are guys tell me they want to eat a juicy steak or juicy ribs.
Okay.
corn on the cob. Ladies tell me they want corn on the cob. Other things I hear are salad with cucumbers or a lot of nuts. People tell me they want cashews, pecans, which I like. So they can eat anything that they want because the teeth are solid like a rock, like your natural teeth. Literally like a third set of teeth.
Is that right? So it's like
Yes.
a third set of teeth.
Yes.
Okay, now you brought some photos.
Yes.
What are we looking at?
Okay. Well, Randy, this is one of our patients. She came to us. She had been to numerous dentists, and they all told her that she couldn't have implants or fixed teeth because she had no bone. And she literally was frustrated with that. She had a partial. She didn't like it. It was bulky, didn't look good, didn't feel good, wasn't natural, couldn't taste her foods right. And that before picture is her smiling where she doesn't show her teeth. She doesn't want to smile.
So that's her version
Yes.
of a smile.
Yes, that's her
Okay.
version of a smile before. So for her options were to give her a better denture, but she didn't like that. She already had that. She wants to have something fixed. She wants something natural that felt comfortable for her.
So teeth that don't come in and out.
Yes, so we were able to give her implants with fixed teeth. And those are pictures
Looks
afterwards.
nice.
She has a really beautiful smile now. And hers is a really good case because it literally changed her personality. When we showed her the picture afterwards, her face literally lit up. She even had tears to her eyes, and she was just exuberant because I can see that this is what she always wanted. The post-op visit afterwards, she was a new person. She got a new hairdo. I know she got new clothes. She was very talkative. She was smiling. That's when I realized that's her real personality. It was hidden before because she wasn't happy with her smile before. It kind of held her back, but
Now you're a dentist.
yes.
So you probably think that the teeth are the most important thing.
Yeah, well, I'm biased because the smile is very important. In fact, for those that perhaps looking for an attractive mate, there's many studies that show the smile is number one.
Okay.
Cosmopolitan magazine, Men's Fitness, Women's Day, they all rate number one is the smile.
Or at least in the
is
top
important.
three. Smile is always always there.
Oh yeah, always there, very important. If you go to another country, people don't speak English, you smile. And that shows that you're friendly.
Good point.
Yeah, for patients in the office, they don't speak English, we smile to communicate that we're friendly, we're here to help them. So the smile is really critical. And if there's a set of twins, one is smiling, social, very outgoing, and the other one is not happy with their teeth, that one may be less inclined to smile. They don't project as well health-wise. They tend to be more reclusive. So the smile is really important.
It's right there.
Yeah.
And so you give people their teeth back, right?
Yes. Mm-hmm.
And it's like, now, do people do this for occasions?
Oh.
Like they're getting married, they're single again?
Yeah, good point. We're in Las Vegas. We get a lot of people, usually women. They do this they want to look better because maybe their daughter's getting married. Perhaps they're dating, so they want to smile and look good. Others, so their aesthetics is number one. That's their primary thing. They don't even care if it works at all. And for those that came in and wanted a pretty smile, there's an added plus. Now they can eat, chew better without discomfort. And so even though they love their smile, the eating part, they like that just as well or even better. Now they can chew comfortably. They can eat like everybody else.
You think mini implants are the future of dentistry?
I do. I believe it's the next generation because everything is getting simpler, more advanced, shorter visits, less visits. And that fits in line with that. That's why I love it for our patients.
Now you do it. Now I guess the way it's normally done is you go to two places.
Yes.
One that does the surgery and one that puts the tooth on top. Is that how it's normally done?
Yes, that's the normal thing. Usually, we in our office we do both. We're trained to do both in our office. We provide the implant placement. Also, we give the fixed teeth. We also do the sedation dentistry for those that have high fear. That's probably half of all the
So
patients.
this IV sedation.
Yes.
A lot of people like that.
Yeah, a lot of people like it. They just want to have a comfortable visit. Usually what we do is give them a pill the night before so they have a good night's sleep. They take medicines before their visit so they're more relaxed when they come in. If they need it, we give them IV during the visit so it's safe, it's comfortable. We just want it relaxed. Patients wake up. It's not uncommon. A lot of patients will tell us that They didn't realize they had saw us, or they thought they missed their visit. But they leave with their teeth smiling already. So it just makes it nicer, especially.
Now, I in the green room, I spoke to your wife, and she said, which was hard to believe, right?
Yeah.
She says that some people at home, they think they missed their appointment.
Yeah, very true. It's really true. Yeah, that's very true. My son's girlfriend, same thing. We did IV sedation for her, and when she woke up, that was like her exact comment. That, oh my gosh, I missed my visit. But they don't have a memory of. We hear that not uncommonly.
Is that right?
Yes.
Okay, so you have more photos. What else are we looking at?
This is a patient here who came to us. She had bad teeth, bad gum. She wasn't happy with it. She didn't want a denture. She wanted fixed teeth, and she wasn't very happy with her overall smile. She actually had consulted an oral surgeon and plastic surgeon to think about changing her smile. But this is the before, and here's her after. We were able to change her smile. We were able to give her fixed teeth. In fact, afterwards, she was elated because she was one of our patients that it brought tears to her eyes. When she showed up for her post-op visit, we noticed she got new clothes, she lost weight, got new hairdo. She was very talkative. She loved her smile. It changed her personality.
And the teeth look real.
Yeah, the teeth look real.
How much do they know what they're going to look like? Do you give them any input?
Yeah, I usually show them some either pictures or models to give them an idea, but they don't really know until it's in their mouth. So a lot of them are just elated when they look in the mirror.
So with this woman, they're locked in.
Yes.
Right? Supported by mini implants.
Mm-hmm. Yes.
And when they see it themselves in the mirror the very first time.
Mm-hmm. Yeah.
I guess sometimes because of the sedation, they're out of it, right?
Yes.
So,
yes.
But when they do see themselves in the mirror,
yes,
it's an emotional time.
Oh, it is. It's not uncommon that I notice. It seems like their face glows. Their eyes start to glow and radiate, and they're very happy. In fact, true story. My son was with me watching me deliver the teeth to one of our ladies, and he said, "Oh, she was really happy," and that's not uncommonly what we see, and the tears will start to flow, and so they love that.
Depending on their story, do you ever get choked up, or your team, or your assistant has to fight it back?
Yeah, sometimes because women are emotional. They love it. They love cosmetic things, and it can change their personality. This is one of our patients that had a life-changing sort of event. This is another example of our patient. He's actually a current patient. His upper teeth, we have done implants and crowns before. So he has fixed teeth on the upper. But as you can see on his lower, he has not too healthy teeth. His gums are in bad shape. So, but he is a guy, he was actually okay with it. His wife was not happy with it.
The lower teeth?
Yeah, the lower teeth. Wife's care, she wanted him to be presentable, look nicer, and be healthier. So we gave him sedation. So in one day, we were able to take out his teeth and give him new teeth. So this is his after now. And you can sort of see it. It's kind of a strange smile because he wasn't used to smiling. So he's used to.
So he was showing you his lower teeth on purpose?
Yes, yes.
So his upper are also supported by mini implants?
Correct.
Is that right?
Yes.
So now he has upper and lower that don't come in and out?
Yeah, he has full upper and lower fixed teeth now.
And what does he say? Like when it's all done and healed up?
Well, he was just happy to eat a steak. That was his big thing.
Steak was a big deal.
Yeah, a lot of guys, they want to eat a big juicy steak or juicy ribs. That was really important to him. A lot of the wives, they're very social. They want their hubbies to look good. They want to be able to spend time with the grandkids and family and friends with the hubby presentable. So I see a lot of it. A lot of it is that.
Do they ever call and say, how soon can I eat? Or are you sure I can eat?
Yes. In fact, our last patient that I showed you, one of them previously, she called and asked if it was okay to eat an apple. So we had to tell her, yes, they're so used to not eating the things that they want to eat with dentures or removable partials that they are shocked that they would eat.
It's got to be a little scary for them, eating something hard for the first time.
Yeah, it's part of what they've been missing from their life. Now we're giving back to them what they missed or made better. So it can be a very life-changing thing for them. Their personality comes out again. Their charisma comes out. I noticed that they're more talkative. They're more social. They're not holding anything back as far as teeth that they're not happy with.
So there's that many people.
Oh.
Because I know a couple denture wearers. Mm-hmm. They never complain.
Yeah. Oh. Well, Randy, they're not going to complain to you because you're their friend.
Okay, okay, good point.
Yeah, they're not going to tell you the stories about their dentures or their teeth that they're not happy with. That's a private sort of thing. If you're wearing dentures, Randy, let me tell you about your life with a denture. If you are perhaps going to a restaurant and you look at the menu, many times you have to look at it from the perspective of choosing what you know that you can eat, not what you want to eat. The teeth don't work the same. The denture is a piece of plastic that you rub the food together. It's not like your natural teeth. So that's one perspective. And another example would be seniors. They're quite active in Las Vegas. They do golfing, bowling, they do all those things. And they're very social. They want to get out to eat afterwards. So a lot of times they may have to make up the excuse that, I got to do babysitting or I got to go feed the dog. I can't go because they're afraid to eat in front of their friends. Another example would be you're out to eat at a restaurant and food gets stuck underneath. So you have to excuse yourself to go to the restroom to clean the denture. And could be very embarrassing should someone walk in the middle of you cleaning your denture. If you're that same denture wearer, some people, they don't care. Right in the middle of in public, they'll just take out their teeth and they'll just clean them out just like that.
You've seen it, or they tell you?
The wives told me.
Wow.
So the wives,
they hate that, I'm sure.
The wives are very embarrassed by that, and they also tell me the same story of, Grandpa, how come your teeth come out? Again, Grandpa may not care, but the wives are the ones that get embarrassed and they're concerned. So those are the stories that we hear. Another good example would be wives that have dentures. They tell me they would never let their spouse see them without their teeth. I hear that all the time. A good example would be, we had a patient. She told me her house caught on fire, and she had to go back there and get her teeth. She almost had to kill a fireman, she told me.
Is that right?
Because she had to get her teeth. She's not going to let her husband see her without her teeth. And I hear that.
She had to run in to get her denture.
Yeah, she had to run in to get her denture. So that's very true. People with dentures, they may be afraid to laugh out loud because their teeth may fall out. There's another true story. One of my patients, she's attending the birthday party with her granddaughter. Stratosphere Tower, the ride that goes around.
Yeah.
And she told me she let out a big yell, screamed because she was scared, and her teeth flew out of her mouth.
At the Stratosphere.
That's the Stratosphere. She said, I hope it didn't hit anybody down below. But that's why she came to see us. And in Vegas, we get a lot of seniors that are very active, they're dating.
It's a healthy group of people.
Yeah, and they're dating and active even in 50s, 60s, 70s, 80s.
How old can you be to do this? With the minis?
Minis, age is not really a blocker. We have patients in the 90s having fixed teeth.
Really? Why would a 90-year-old want to get mini implants?
Well, Randy, they have the same reasons that you and I do. They just want to eat, smile, chew.
Okay.
Yeah, even at that latter age, they still have self-esteem. They want to feel good about themselves. They want to eat, chew.
But are they more likely to fall out if you're 85 years old?
No, as long as they're healthy, as long as they can get to the office, and usually we can help them. Because the key is that with the minis, we don't need as much bone as traditional surgical type.
You just kind of pop them through the gums?
Yeah,
that might be an overstatement, but that's what you do?
Yeah, pretty much. It's less invasive. It's a lot simpler procedure. It's a lot kinder for the patient, my bias. It's a lot more comfortable for the patient.
And it's less expensive.
Yeah, and it's less
than traditional.
Than traditional.
Because you could do both, right?
Right, correct.
And you really like these better? The mini small diameter implants?
I do. It's just my personality. I think less is better. It's more conservative. Keep it sweet and simple. You hear that saying?
Yeah.
That's me. That's what I do.
As long as it works. So as long as they can eat and chew.
Yes.
Have you ever put a mini implant in one of your own family members?
I have. Yeah. In fact, one of my parents has the minis, and it works good. It's really solid. In fact, my bias, the minis are small diameter implants, and and they've been around in medicine for a long time. Even I have 9 minis in my body.
You have mini implants too?
Yeah.
Okay.
So they work great.
Okay, good. You have more photos?
Yes, I do. This is my patient here. You can see his before smiling picture. Doesn't tend to show a smile too much, but
that's his version
that's
of a
his smiling
smile?
picture.
Okay.
He has experience with implants. His upper teeth are all implants, by the way, traditional.
Okay.
So he's experienced how it is. But his lower teeth, his complaint was they're loose, they're sore, they're hurting him. And he's
A lower denture
yes,
he had.
Yes. Okay. And he's a really social guy. He loves to square dance. Him and his wife, they want to they're very active. They do competitive. For him, in one afternoon, we can give him fixed teeth. He comes into us, we sedate him. He will leave with fixed teeth, so everything's more comfortable. He can eat, chew, smile.
How
be
soon? How
functional.
soon?
Well, as soon as the anesthetic wears out, that they can
Really?
eat and chew.
But they have to take it easy at the beginning.
They do. We like that, but
How soon could they eat chicken?
Oh, as soon as the anesthetic wears out, but they got to have soft chicken. But generally, the vast majority of things they can eat.
Now, you've made dentures, though,
Yes.
for hundreds of people in the past?
Yes.
Okay. So what do you say to those people that are watching this?
Oh, okay. Well, as I mentioned, we've done dentures, a lot of dentures over 30 years, and a lot of our denture patients are frustrated. They don't like it because it's bulky, it doesn't feel natural. A lot of people gag.
Okay.
They can't taste their foods. They don't like that adhesive. It's not natural. So for those patients, we can anchor their teeth. It fixes them so they can get rid of the
So what do you
adhesive.
say to them? I mean, if they're watching this, you made their dentures,
Yeah.
you say what? Come in?
Yeah.
Get them locked in?
Yeah, I would say I have them attached, anchored. It's a lot better. Now it's half the cost of traditional type of implants. It's a lot simpler, a lot more comfortable.
So a lot of the people you recommended implants to that you made dentures for, but this is before the mini implants came along or before
Yes.
you were doing the mini implants?
Correct, yes. So now it's a lot different ballgame with dentures compared to traditional implants as with minis. It's a lot simpler, it's not more
So
comfortable.
the minis do work?
Yes, they do work.
Okay, good. And then there's studies to back it up? People have been in them for a long time?
Yes, yeah, a lot of studies now. I've done traditional ones for over 25 years, and now I love the minis because it's kinder for our patients. Works great.
Okay, good. So we're out of time. If somebody wants a consultation, do they get to see you?
Yes.
And we should mention, Medicare, Medicaid, and most insurances don't cover, well, Medicare, Medicaid do not cover this at all in the U.S.
Yes,
You have financing available?
we do. It makes it easier for our patients.
And even with the best insurance, I guess, available, it pays for a portion of it.
Yes, so we have financing to make it easier for all of our patients.
I want to thank you for coming on the show. We're out of time. Great stuff. They can go to your website, look
Yes.
at this?
Yes.
Okay, good. You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.